What we're going to look at now is just an introduction to start with on the changes in the guidelines for 2010. October 2010, the ILCOR, the International Liaison Committee of Resuscitation, the ERC, the European Resus Council, and the UK Resus Council announced all their latest changes in respect to basic life support and CPR. These changes typically happen every 5 years. The last changes were happened in 2005, hence we've now got the latest changes in 2010. The changes respect, they look back on problems that have happened in the past and have a lot of meetings to find out what the best way of actually performing CPR is. And they found a few problems. Some of the problems were people were not pushing hard enough or deep enough within the compressions, or hesitating between the compressions and the breaths. They also needed to take into account the fact that AEDs are a lot more widespread. Also, other points were included in it regarding to vomit, and making sure that everyone identifies agonal breathing. Now we're going to have a look at these shortly in a little bit more detail. As far as the changes are concerned, all of the latest changes have now been put into all of our e-learning courses, so all of those are 2010 compliant, as is all of our classroom-based courses. What we're going to do now is look at the individual changes and have a look at each of the individual items that have been changed recently. First one of them is when you're actually calling for help, you need to also make sure that a defibrillator, if there's one available, that you've accessed it. If you're calling for help or you've got someone there who's calling emergency services for you, get them to find out whether there's an AED on site. Now the emergency services will bring those with them, as will community responders, but if there is an AED, maybe you're in a shopping centre, a railway station, anything like that, get the AED over to the site and start working with it. If you don't have formal AED training, still get the unit and use it. They are very simple, and you'll see a video later on the course on AED introduction. You'll hear how they talk to you and tell you exactly what to do. Other of the key changes that we found with it, with CPR, is that people were, when they're doing their compressions, they're not really pushing hard enough or not really doing effective compressions. Effective CPR is crucial. What we're going to do now with the compressions, where it used to be pushing down 4 to 5 centimetres, we're now pushing down 5 to 6 centimetres. This extra depth is allowing a lot more blood to be circulated in and out of the heart, and also by increasing the speed up to now 100 to 120 beats per minute, we're getting far more effective CPR. So with your compressions, we're still using hands exactly the same way, but this time we're connecting the hands together, we're popping them over the chest and pushing down, but this time pushing down much faster and much harder. It is a lot more difficult to do because you're going to get tired a lot easier. So it's very important to make sure that you've got a second rescuer who can take over maybe after about 2 minutes. So when we're doing the compressions, make sure you stay arms straight, right over the patient, push down, and you're pushing down, remember 5 to 6 centimetres, and a rate of around about 100 to 120 compressions per minute. We're still doing these compressions at a rate of 30 compressions and 2 breaths. So the actual number of compressions has stayed exactly the same. It's just really the depth and the speed that we're delivering the compressions at. Other changes have happened with the breathing, which is clarifying a few things on the respiratory side. First one with it is when you're checking for breathing, you want to make sure that you've got the airway open, you do it for 10 seconds, and you're looking for signs of normal breathing. There's also, when someone's in this state, around about 40% of the time, you can get what's called agonal breathing. Now these are just gaspy type noises. They're not real breathing. So when you're actually listening for that breathing, make sure that you can clearly hear air going in and out. We only do that breathing check for 10 seconds. Other things with the breathing is we're looking out if the person has vomited during the process. Often if you're blowing air into someone's lungs, then you'll find that the excess air can be blown into the stomach and this can be regurgitated out. So when we're actually doing the breaths, we want to make sure that we're only doing 1 second breaths, no longer. We want to make sure the breath goes in, out in just 1 second. If the person did vomit, you need to turn them onto their side away from you to allow the vomit to come out, turn them back onto their back and starts the whole process again. Other things you can do with the breathing, if somebody has a facial trauma or there's a reason why you don't want to put your face down onto theirs and you haven't got any pocket mask or face shields, You can, if you need to, do mouth and nose ventilations. To do this, you're going to need to seal off the mouth, open the airway and blow into the nose. By doing these breaths and being aware the whole time, you also need to make sure that you're not delaying time between the compressions and the breaths and back to the compressions. What we found before was people were doing the compressions, spending a lot of time, taking breaths, taking time opening the airway, putting the breaths in, leaving a few seconds between breaths. What we need to do now is make sure that once we stop that 30th compression, we move on to the breaths, quickly open the airway, squeeze the nose, put the 2 breaths in, and then get straight back onto the compressions. The most important thing with CPR is to have effective chest compressions. If we don't do those chest compressions, the person's heart is going to be starved of oxygen and the chance of being resuscitated with the AED is much reduced. Final thing we just look at is just how long to go on for and when to stop. But you need to clarify this. If somebody shows any signs of life and any signs of normal breathing, then we would obviously stop CPR. If not, we continue. We continue CPR, whether we're using the AED, follow the prompts on it. Again, if they show signs of life, we would stop. If not, we just continue. We keep going as long as we can. Just remember that you're going to get very tired. Sort of time, maximum time someone can do this effectively for is around about 2 minutes. So it's not very long. So the whole time you're starting CPR, try and find someone else who can help you, this can come over. And while you're doing compressions, you can talk to the person and then consider getting them to hand over after a couple of minutes, and then you swap back after a couple of minutes with them as well. Other times you may need to stop. Obviously, if the paramedics come in, don't just straight away stop. Wait for their guidance. If you're doing effective CPR, they've got all their equipment to get ready. So you want to make sure that you carry on doing CPR throughout that time. Final time when you may think that you need to stop giving compressions and CPR is if you're just too tired. You will get to a point eventually where the person, you've done as much as you can. CPR is not as effective, it's not a guarantee to be effective. Round about 20% chance of survival, depending on when the AED arrives. So all you can do is do your best. Just keep going, do effective CPR as long as you can. If you're training in the classroom, then it's a little bit different from doing it for real. If you do it for real, you'll have the adrenaline in your body, you will be able to perform a lot better.